Hello friends, welcome back to my channel NNAVPREET. I hope you all are doing well. In today's video, I am going to discuss regarding your questions related to NNAS process, how you can get a nursing license, and what are the best courses to choose, and when you need to start doing NNAS process, and what is the best time to study for Nclex or CPNRE. So without wasting any time, let's just jump over the topic. So the first most commonly asked question is what course to choose and which is the best to get RN eligibility. So as we are international nurses, when we apply for NNAS process, we might get a lot of competency gaps. So it is always wise to choose a nursing course that comes with clinical hours, because those clinical hours will help you to meet your competency gaps and complete the practice hours requirement. So always go with a course that comes with a clinical hours. So the second most commonly asked question was when to start NNAS. So NNAS process, the best time depends on your immigration status, on which status you are coming to Canada. If you are coming to Canada as a permanent resident or work permit basis, then the good time to start NNAS process is right now. If you are coming here as a student, then it depends on the type of study or the type of course you have taken. If you have taken the course that comes with clinical hours, then you need to wait until you are at the point of finishing your course, and it's only 1 month left to finish your course, and you can easily provide your transcripts after it's done. So it's always best to wait until your course is finished in case of if you're coming with clinical hours. If you have taken a course that does not come with clinical hours, then the best time to go for NNAS right away. But if you have taken 1 year of study and you're planning to take second year of study with clinical hours, then you can still wait until your second year of study is done. So it's always wise to think, if your study does not come with clinical hours, then you have to do it right now, or you can wait. If you are taking your second year of program with clinical hours, you can wait until your study is finished. So this way, if you are sending all your documents to NNAS, so this will help you to get the advisory report in your favor, and you can easily get the eligibility for your exam. Third most commonly asked question was which province is best to do NNAS. So NNAS process can be started in any province where you want to live in future, where you want to work. So there is no such criteria that you need to start in Ontario, but where you want to live you can start. But the thing is that in Ontario they are flexible with your language requirement, because in NNAS itself they will give you a choice for Ontario that you can waive off the language, and you can meet that requirement when you apply to CNO. But for all other provinces, as far as I am aware, that they will not go ahead to issue an advisory report without a language fulfillment. So the best province that I am aware till now is Ontario, because they will waive your IELTS until you get your advisory report and before you get your license. Next question is how long the evidence of practice is valid for. So evidence of practice is basically your clinical hours. So in Canada they consider it valid for 3 years. If your evidence of practice is expired, they will ask you to renew it. So there are certain ways to renew it, like you can go back home and get the practice experience from any hospital or clinic. And secondly, in Ontario they have specially launched a program to beat evidence of practice itself. If it is an outstanding requirement, then they will ask you to go for clinical placements under Canadian nurses supervision, and they will send your evaluation to CNO, and then CNO will assess it and pass it and give you the license if you fulfill that requirement. If you are doing a course with a clinical placement, then you can show that experience that will also count towards evidence of practice. So the fifth most commonly asked question was, please explain 1 year program is good or 2 year program. I would say 2 year program is always good, because 2 year program will gives you 3 years of work permit. In this way you will have enough time to work on your NNAS process as well. If you can't find 2 year program, then it's always good if you take 1 year program during your first year of study and another 1 year of program during your second year of study. so you can do that as well. The sixth most commonly asked question was, I am a nurse in my home country, can I work as nurse while studying? Fortunately, the answer is no. You cannot work as a nurse in Canada even if you are a nurse in your home country, because in order to work as a nurse in Canada you need to have a Canadian nursing license. For that you need to go through NNAS. After getting your advisory report, you can apply to regulatory body and they will decide if you are eligible to write down Nclex-RN or CPNRE exam. The seventh most commonly asked question was, while studying, what nursing field jobs I can do? So while studying nursing, the best job available is the nursing assistant. You can work as a healthcare aide, healthcare assistant, or personal support worker, or continuing care assistant. Different names for the same position in different provinces. PSW earn really good money. They usually make around $18 to $23 depending upon your experience. You will still stay in touch with your nursing, but you will be working as an assistant. Eighth most commonly asked question was, how can I go for PR, as getting license and finding a job is long? Can I go for PR in non-nursing field? Yes, as you already know that NNAS is quite lengthy process. It can vary, so definitely you can go for PR in other fields as well. As personally, I have so many friends who worked in the food industry. They started from a team member and they went up to supervisor level, and then they got their PR through express entry. So definitely there are options available in other fields too, and side by side you can keep working on your nursing and get your license, and after getting your license you can start working as a nurse. Should I prepare for exam or should I wait for NNAS? So it depends on which type of visa you have. If you are here for study basis and you have chosen a course with clinical arts, then you can wait until your course is finished. If you have chosen any course without clinical arts, then it's best time to apply it now. And the third is, if you have taken a non-nursing, a non-clinical course, and then on the second year you are planning to take clinical art course, then you can still wait until your second year of study is finished. But if you are here on work permit basis or permanent residency basis, then the best time to apply for NNAS right now. And definitely you can start preparing for your CPNRE or Nclex exam, because you need to clear your basics and stay in touch with your nursing theory. Meanwhile, waiting for NNAS advisory report, you can keep studying. Question was, how many hours of experience you need from your home country? So it never hurt you have extra hours of experience, but even if you don't have any experience, then your evidence of practice can be met if you have chosen a course that comes with clinical hours, because those clinical hours will count towards your practical hours. So this way you can easily meet your competency gaps and practice requirement. But right now the Ontario has launched a supervised practice experience partnership program, where they have mentioned you have to finish 140 minimum hours to fulfill this requirement. So 140 is the must hours, and you can even go beyond that. So it never hurt to have extra hand-on experience. So next question was, Nclex-US will help to meet evidence of practice. So Nclex-US is registration exam, and evidence of practice is a requirement in order to get the nursing license. So they both are different things. In order to work as a nurse in Canada, you need to fulfill both the requirements to get the nursing license. But the scenario is different. If you have passed your Nclex in United States and you are already a registered nurse in States, then your experience in the nursing field will count toward the experience in Canada, and your evidence of practice will be met. Otherwise, if you don't have any experience, then you need to fulfill the evidence of practice on separate basis. Your Nclex-US will not count towards evidence of practice. The last question was, how can you pass Nclex without classes? Yes, definitely you can clear your Nclex without classes. All you need is just dedication, and you need to study. So the best way you can do is, if you want to do self-study, you need to go through theory, like whole theory. You need to know your concepts and your basics so that you can apply them while practicing your questions. If you want to study for Nclex, then I can give you the best tip is to go through systems. Just pick one system, like digestive system. Just go through the theory, go through the basics, and then start practicing the questions related to the digestive system. Go over as many questions you can. Try to read out the rationales for the wrong questions. So when you master your one system, go over to the another one. So friends, that was all regarding today's video. I hope I was able to answer all your questions. If you still have doubts and still have queries, you can leave me a comment. I would try to answer them in my upcoming videos. And also don't forget to hit the subscribe button and press the bell icon for future notifications. Thank you and have a wonderful day.